Patients and families are Stoughton Hospital's #1 priority. To provide trusted health information to our patients and community, we present Stoughton Hospital Health Talk with Melanie Cole.
Lymphedema can be a potential side effect of breast cancer surgery and radiation therapy that can appear in some people during the months or even the years after treatment ends. My guest today is Melissa Monte. She's an occupational therapist with Stoughton Hospital. Welcome to the show, Melissa. So first tell the listeners, what is lymphedema?
Well, lymphedema, most people have heard of like the venous system and the arterial system. Well, the venous system is part of the lymphatic system is part of the circulatory system. And what it is that it actually aids in bringing extra water and plasma protein cells back to the heart and to the kidneys so that it can be excreted from the body. What lymphedema is there's a breakdown or an obstruction of this lymphatic system. And if you can imagine it as a bathtub, and if the drain is working properly, you have no problem. The water just runs in, runs out, and your tub will not overflow. But let's say that drain gets backed up. What happens is, the fluid still keeps flowing, but we have this backup, and eventually our bathtub is going to overflow. And what happens then is we get all this extra fluid and this extra protein-enriched fluid that is just sitting there and stagnant in our body. And that is actually what lymphedema is. It's this buildup of fluid that the body can't get rid of because there's an obstruction, there's a breakdown of our lymphatic system.
What a wonderful explanation. So how does surgery and radiation therapy for breast cancer contribute to lymphedema? What does that do to the lymphatic system?
Well, it causes that breakdown or that obstruction that I was talking about. So unfortunately, when you have cancer and you have surgery, you are at a higher risk of developing lymphedema. Now, it's not everybody does not develop lymphedema, and if you have radiation and surgery together, your risks do increase. But it's, they say about 1 in 3 women that have the surgery and radiation may develop it, and they're unsure of a clear reason why some do and why some don't. There could be a genetic component to it that they're not certain of. But just because you do have surgery and radiation, doesn't guarantee that you're going to get lymphedema. And I think that scares people a lot because they think that they're automatically going to get lymphedema, and that's not the case.
So does it begin with a series of stages, Melissa? Is it something that you'll notice at the beginning that maybe you can get help for before it starts to get really bad?
Yeah, that's a really good question. And actually, recently I've had more individuals refer to me right after surgery or maybe even before surgery to kind of give them an idea of, signs to look out for. Initially, the first week, the first 6 weeks actually, after having surgery or radiation, there is going to be this acute edema that a significant amount of people develop. Again, not everybody, but that is not the most worrisome. It's when you start to develop 6 months later, you start to see the swelling. That's when I always tell people, the first 6 weeks, it's okay if you see some. We'll try to manage it. We'll give you some treatment ideas to get it down. But if you start to see it 6 months from now, that's when we really want to get you in and get into the treatment aspect of it.
So then what will they notice if they're starting to see that fluid buildup? What can they do about it?
One of the best things is elevation. And then oftentimes a referral to a certified lymphedema therapist would be ideal. We start you off doing a manual lymphatic treatment, and what it is it's a technique where it's very hands-on. So we use a circular motor pattern, and we clear pathways and we open up pathways and then flow the fluid back to try to get that swelling to go to other pathways. So when those pathways are destroyed, and it's not like all the pathways in your body are destroyed. So we try to route the fluid around those injured areas and around those obstructions to try to get new pathways to open up so that we can get that fluid flowing. And then so we have the manual aspect that we do during treatment, and then we also have what medical compression bandaging that we use. And it's a light wrapping system, and the bandage actually looks like an ACE wrap, but we don't put it on nearly as tight. It's actually pretty comfortable. People say they hardly notice that it's on at times. So we use those bandages to try to get, again, the bandages take the place of my hands after a treatment session. So they wear those and they rewrap, and then that's how we try to get the fluid out of the extremity. And then we top that with some light movement exercises. So we flow the fluid, and the lymphatic system doesn't have its own pumping system, so it uses your muscles to help pump the fluid out. So we give you some home exercises to do that help, again, promote that movement of that fluid. Finally, after we've done the manual therapy, we've did the compression garments, when the fluid level has come down, we fit you with a compression, either a stocking or an arm sleeve that you can wear, 23 out of 24 hours a day to help push that fluid out and keep it out of the extremity.
Is this something they're going to have to do for the rest of their life?
Unfortunately, yes. Now, there is chances that if we get it down, you won't have to wear the compression garment as often. And once those pathways get created, you might be able to keep it at bay. But it's always something that you have that obstruction, you have that, you have those lymphatic system that is destroyed. So you're going to have to be on watch for signs of increase of fluid again in the arm. Some people complain of fatigue, pain. A lot of people just say they just know it's coming on. They just feel that they're more swollen. So then they just put on the compression garment and wear it for a couple of days. But yes, it's something that you're always going to have to be aware of and know that the swelling can come back and you are at greater risk because of it.
In just the last few minutes, Melissa, what great information you're giving today. Give your best advice for women who may have been diagnosed with breast cancer on this concern about lymphedema and what you really want them to know about things they can do at home and who they should talk to.
Well, I always say as soon as somebody comes in, I think it's great that they're being proactive. And I think that's the most important thing is that once you notice, even if it's in those first 6 weeks, and you know that you're having some swelling, and you know that, okay, well, this isn't 6 months, but I want to know what I can do. Talk to your doctor, come in and, see a specialist, and we can give you some ideas of, make sure you elevate, make sure you protect your skin, because when you have that increased fluid, you're at risk of infection. And once you have a wound and you don't have that good circulation, again, it's going to be harder for your body to get rid of it. So just be proactive and really talk to individuals, talk to other people that have had cancer, just to get as much information as you can.
And why should they come to Stoughton Hospital for their care? Tell us about your team.
Well, we are very dedicated, and we're a personalized hospital. We have good individualized care. And myself, I'm the certified in lymphedema, so I will definitely take the time and explain to you what's going on in your system and give you some good techniques to take home to hopefully improve your living quality.
Thank you so much for being with us today, Melissa. You're listening to Stoughton Hospital Health Talk, and for more information, you can go to stoughtonhospital.com. That's stoughtonhospital.com. This is Melanie Cole. Thanks so much for listening.